Ritankar is an American scientist and technology entrepreneur. He's the founder and CEO of Forta Health, an AI digital health company that provides personalized care to children with autism. He was also the founder and CEO of Dascena, a healthcare focused machine learning AI startup. At only 18 years old, he was the youngest university medalist, top graduating senior, in at least a century among over 6,000 graduates from UC Berkeley. He has been featured in San Francisco Chronicle, ABC News, Times of India, and over 100 other media outlets around the globe. He's now with me on Nadia's Lab talking about Forta Health, AI, and how is AI shaping and changing our lives? What can we do to adapt to these changes? Stay tuned. Hello, everyone. Welcome back to Nadia's Lab. Today, I'm very grateful to be joined by Ritankar Das. Ritankar is a co-founder of Forta Health, a company which he's going to tell us more about. And Ritankar, thank you so much for joining me today. I'm very grateful to have you here. I wanted to have you on my podcast for a long time now because I feel like you are incredibly intelligent and I really appreciate what you do. And I feel like you really bring innovation to healthcare. So, do you want to tell our listeners a bit more about yourself and what is it that you do?
Yeah, so at Forta Health, we help family caregivers be part of the caregiving process. We primarily focus on chronic conditions, and initially we focused on autism spectrum disorder. So enabling and encouraging and equipping family members to be part of the care delivery for their children.
Yeah, that's incredible. So, autism, something that is, I think, also widely misunderstood as well. So, what inspired, what was the turning point in your career that made you choose to do this?
Yeah, I mean, there was a couple of different things. One was I had a previous company where I developed AI systems and sold them to big pharma companies and to health systems. And one thing I learned from that experience was that the care delivery process was very broken. For example, I remember we would work with one of the largest health systems in the East Coast of the US, helping them with their clinical population around sepsis, and we would be doing sort of this cutting edge machine learning work for them. And then we would get requests like, "This is all great, but could you fax us the results?"
Okay.
And jokes said we would literally fax the results
Oh,
over,
wow.
and that would be used in their clinical care. So we saw kind of quite a bit of a gap in the workflow and care delivery side of things relative to where technology had advanced. And then we figured that with the technological advances, you could re-equip and bring more care into the home if you could engage the folks, like, kind of back to basics of human caregiving, of engaging the family in the care effectively and giving them support by using sort of AI systems to help sort of guide and assist in the therapy process. So that's sort of where the concept came from.
Oh, wow. And in terms of AI, because it's a very broad definition, what exactly is it? Like, if you give me a little bit more detail of the actual technical equipment and systems or processes.
Yeah, so what we do is we look at information from an individual's background and or their family background and some of the surrounding circumstances and have an algorithm that can make suggestions, which ultimately has to be reviewed and adopted, or some, but not always adopted by a clinician, in order to personalize the care for an individual. So that's sort of the use case of it, is to personalize and take away some of the trial and error back and forth that is often common in the health system.
So you work with doctors, right? So the clinicians essentially they're on board with it. They're the ones utilizing this. Is that correct?
Yeah, we don't have, we mostly have clinical staff who are called BCBAs, board certified behavior analysts.
Okay.
And those clinicians work with our clients in coming up with these therapy plans, but they can use AI to help them in that process.
And what was the feedback so far? Like, how has it improved patients' journeys and the whole diagnostic process?
Yeah, I think a big part of it is really enabling and engaging the family members in the delivery of the care. And that has had a very big impact, combined with the whole kind of process of getting folks access to care rapidly and all of that. And we've seen pretty significant improvement in clinical outcomes that we've published on when folks go through our system that is sort of maybe more personalized and more engaging of the family than sort of what they might expect in the standard brick and mortar care delivery process.
Fair. Let's talk a little bit about autism. Do you have any like statistics of like how common it is? Maybe how often it's misdiagnosed or undiagnosed, and like how it's usually treated or patients taken care of in general.
Yeah, so the incidence rate as measured by the CDC has been going up steadily over the past decade. The most recent numbers are almost 1 in 30 folks or so, and that incidence has been going up. We don't really know why. Some of it may be attributed to more available diagnosis and more folks getting diagnosed, but certainly the underlying prevalence is going up for reasons we don't fully understand. So it's something that's becoming more common. So we should obviously understand why that is, and at the same time do more to bring access to intervention for those who want it.
Absolutely, that's brilliant. And I mean, have you seen any pattern? Because I personally, something from working in a hospital, I've seen that autism is a bit more common in families where women had children at later age, like in their 40s. Is this something that is there any, have you seen this? Is there any science behind it, or it was just random cases that I've seen?
I think there is some correlation there. Again, not fully understood. There's a variety of factors that could be have higher risk for incidents. Having children when you're older could be one of those factors, but it's not fully understood why.
Mhm.
And it's a correlation, not a clear causation. But what we do know is that broadly the incidence has been going up over the past 10, 20 years at a
It's
pretty fast clip.
not known why. Interesting. Okay, so moving back to you co-founded a company, and how do you build your team? How do you delegate, but at the same time, like, keep an eye on everything? And what is it something that you would advise to someone who maybe wants to start a company in terms of building the team and also like starting your own company?
Yeah, I mean, I think team is a very critical part of the experience of the company, the success of the company, the journey, and all of that. So team is a pretty critical aspect of it. So over the years, one thing that I found to be very important is to be able to work with folks you really enjoy working with. That's a really important variable that I prioritize less in the past and find more and more important over the years. And because you're gonna, end up spending a good amount of time with the folks you end up working with, and any entrepreneurial journey has its ups and downs. So you want sort of again people you enjoy spending time with because you're gonna have to go through the ups and downs with them. Certainly you want people that are competent, hardworking, and are able to think on their feet and be good thought partners
Mm-hmm.
as you go through the journey and all of that. I think that some of that is kind of well understood and more well accepted. But the other side of it, though, is perhaps just as important, in some ways more important. The relationship you have with everybody and how that what that makes the journey not only like what it makes the journey like, but also how it affects the outcomes of the journey.
Fair, yeah. I agree. If you had to name one like big mistake that you made or something that you regret doing, like a mistake in business or in life, what would that be?
Yeah, I think an interesting thing to sort of keep your eye on is when is it right to scale and how in the business context, because a lot of things can change in the market, a lot of things can change in what you're doing, and you might have some initial signals that say, okay, you figured out some equation that works, you could be scaling that, but then you might run into some underlying changes to the market, and you may not respond to it fast enough. That's certainly a mistake I've made in my life, and that you kind of have to be vigilant of like what has changed. Do we have to refine the structure that works before scaling up? So obviously understanding the full end-to-end spectrum before scaling up, but then also keeping an eye on where things are, with things that are moving around, and recorrecting course.
Interesting. Fair. Thank you for sharing that. AI has become a part of our life, and it has improved so many things, made some things more accurate, faster. But shall we be worried that AI will be taking our jobs and kind of replacing humans in a lot of things? And how can we learn to live alongside with and use the most of it, and also, adapt? How do we quickly adapt to the changes and improvement of AI?
Yeah, I imagine like most other big technological shifts, it'll end up changing the kind of work we do more so than anything else. Um, like I think there was like a time in the past where people used to literally make spreadsheets on paper that were spread out over like big tables or something like that, as I understand it. And that was something folks did. Certainly we don't do that anymore. We have software for that, and it's very popular software, the spreadsheet software. That doesn't mean we no longer do the work, on a spreadsheet. The logic and that work is still very much there, but the physical work of organizing them and things like that has gone away. So perhaps before you needed one group of folks to learn one set of skills, and now you need a new group of folks or the same group of folks to learn a different set of skills. I exactly don't know exactly how it's all going to play out, but my suspicion is there will be large changes to how people spend their time over time, and broadly, most of these technological innovations brings a lot of productivity, right? I think at one point in human history, people worked 7 days a week, and we don't do that anymore. In large part because of the advancement of technology. I don't know if that will exactly be the case with this one, but broadly, what has been true, I think, will repeat itself is that we will do different work over time. Number one, and number two, we will benefit from the productivity gains through quality of life improvements for everybody as the technology becomes available to everybody.
Fair, fair. Do you think we're gonna move to 3 day working 3 days a week or 4 days a week, and then we have actually longer, that actually maybe Thursday, Friday, Saturday, Sunday considered weekends?
I'm not sure about exactly how this is going to play out, but what I do know is there will be excess productivity to go around from these AI systems that will just generate productivity without humans needing to do work, right? So it'll give us more abundance. How that abundance will get used and distributed, I think, will vary. I think it won't be the same for everybody. Some people will choose to work more, or others will choose to work less. I think there will be more flexibility, just like we've even seen in the past 30 years, more and more flexibility the last couple of generations than there was in generations prior, where people having various types of entrepreneurial life journeys, like not even necessarily starting a business, but like, being a creator, just kind of like starting a business in its own way, or doing all sorts of other types of routes which have different work life balance decisions. And I think there will be more choice afforded to people. I don't know how that's all going to break out exactly, but I think people are going to have more choice because there's going to be more productivity to go around from the machines. So the humans are going to have more flexibility in what they do with their time.
I think that's a very good way of looking at it, and not being, we shouldn't be threatened by AI essentially. We should just adapt and utilize that in our advantage so that we have more free time. And then how do you, because obviously you work a lot, how do you try and, maintain the work life balance and also take care of yourself and your well being and mental health?
Yeah, it's a difficult thing, to balance all of the needs of you as a person, you as a part of a family, you as a part of a friend group, you as a part of a company, all of that, right? You wear a lot of different hats in the modern world. To be honest, it is hard to figure out. I mean, I definitely go through seasons. There are time periods where you're more focused on one of those roles than others, and you try to remember that all of it sort of has to be in harmony with each other. I think balance is a little bit. little bit challenging, right? Like people can't really turn one thing off and turn another thing on, in my experience. Like if there's
Exactly.
a fire at work, you'll probably bring it home. If there's an issue at home, you'll probably bring it to work. So there's some degree of integration that is natural. And I think it is really dependent on a variety of factors to how to do all that balancing. Depends really on your goals, where you are, what other obligations you have in life and all of that. So I don't think there's actually anywhere close to a one size fits solution for this. I've found certain things, and people have different things that they're good at and different things that they, at least for myself, there's some things that I'm good at, some things that, bother me, some things that bother me less, that bother other people more, some things I find more energizing. So what only thing that I've seen to work is to discover what works for me in terms of, say, recharging, or in terms of having balance or finding things, or mechanisms, and learning more about myself, and then coming up with a bunch of different strategies based on, how I interact with the world, and how, what my
Yeah.
reactions are to things.
That's brilliant. Yeah, it's like also practicing mindfulness as well, I guess. And as a pharmacist, I love to ask this everyone. Any favorite supplement or wellness hack or even foods that you live by and you swear by, and it's your favorite thing and it's your ritual?
Yeah, I mean, I don't do anything very very clever. I try to maintain, a diet of mostly fish and vegetables, and I found that to be like a good balance for me. And then in terms of like life things, I think getting enough sleep is sounds like an obvious thing, probably very well understood, but not often practiced.
Mm.
Just sort of consistently getting enough sleep, and different people need different amounts of sleep. So figuring out what you really need, but then really prioritizing it, I think is very important in the long term. I don't always do it successfully, but that's something I try to do, is to make sure I get enough sleep. And the main things that you want to try to hit, or at least I try to hit, are, sleep, work out, eat well, and meditate each day.
Amazing. I mean, each day. Oh, that's great. I love that. And meditation, is that like at home on a meditation mat, or is it like in a gym or some meditation studio, or is it at home?
It's usually at home. Sometimes I might do a little bit, outside, but usually at home. Nothing super fancy, but just some time to. Uh, doesn't have to be extremely directed, but just some time to stop and, sit in my thoughts a little bit, and think about and digest what has happened.
Reflect on your day, I
Reflect.
guess, and everything. So finally, I just want to go back to Forta Health. How has Florida Health changed? I mean, I know we kind of talked about this, but I just want to talk a little bit more about that. So, how has it changed the outcome? So, let's say I'm I'm someone with autism or someone in my family. How has Florida Health changed their outcomes, how they feel, how they're taken care of, and maybe their future?
Yeah, so one of the big value adds for what Ford offers is the ability to get access to therapy where you might not be able to access it, either, maybe because there's no clinics available, within close to you, uh, or because, your type of, your child might not qualify for therapy at other places. Because we do a telehealth led approach, and we involve the family in the care, we'd be able to bring access to therapy for those families who want it. And in doing so, we've seen all sorts of interesting, things we've been able to help the families do. For example, they may have had a child that, was nonverbal, and we were able to help the, child become verbal, for example,
Oh
able
wow.
to speak, and communicate. And there are various other things like that, where there might be, a child that might have a lot of tantrums and other things like that, where the family has struggled. We've helped equip the family, and help the child have a much better family relationship, and then they can perhaps go on trips that they weren't able to do before, and things like that. Some cases had a very profound impact on families.
And do you see a lot of variety in like how patients present and the symptoms they have when it comes to autism? Because it's a spectrum of like this spectrum, right? So do you see a lot of different presentations?
Yeah, so our clients, I mean, we have clients,
Yeah.
and our clients, it is a spectrum. So there's folks with all sorts of different types of presentations on that spectrum, and various different types of interventions, and sometimes no intervention that might be most appropriate given the goals of the family and where the client might be on that spectrum. So we actually are very thoughtful about what will work for an individual and try to personalize the intervention and support and training around uh, what is most likely to be helpful for that specific individual.
That's amazing. The personalized care, I think, is what's often um, there's not enough of it essentially. So that's something we definitely need. And any final thoughts and advice for anyone who would maybe like to follow your footsteps or start a company or a project, whatever it is, that involves something like this and that involves AI paired with maybe healthcare medicine or something else, but essentially AI with something. And what's like the starting point, the kind of basics, to get things right and to get things going essentially.
Yeah, I mean, we need more and more folks to come and um, innovate within healthcare. Obviously,
Yeah.
it's an industry as a whole that is lots and lots of things that have, uh, you know, that are broken, frankly, in a lot of different places in the system. So the system needs the system itself needs to be healed, in order so that it can then heal
Other
all of
people.
us, yeah, a lot better. So yeah, so it would be very good to get more and more bright folks to come in and do that work. It's because you're dealing with health and folks, there are challenges and procedures and things you have to follow for good reason. Usually for good reason. Sometimes it's well-meaning, but not designed very well, but usually there's a good reason behind it. So that can sort of be something you need to understand uniquely in this industry that you may not need to in other industries, or maybe not quite the same level. So you need to sort of be thoughtful about that. But it's at the same time, just the same on the other side of that same coin. It's very important to do work in this area because it really affects people's lives, and we're all going to go through and be a part of the health system, right? And
Absolutely.
we're gonna all be part of that. We're all going to be involved. So if you can make an impact in this space, you're going to have very high leverage over a large number of people. So yeah, I think it'd be great to have more and more folks come in and get involved.
Absolutely, I agree. Ritankar, thank you so much for your time. This was brilliant. Always a pleasure speaking to you, and I'm very proud of you. And I'm excited for your what future is gonna bring, and your company and all other projects that you're working on. So thank you so much for joining me.
Yeah, excited to be here. Thanks for having me.
Thank you so much, guys. Don't forget to subscribe and join us next Tuesday as well. Bye.